When I first was diagnosed, I guess you feel kind of numb. I had no idea what Ewing sarcoma was.
It was about the size of a 10-cent piece, this little lump.
I just finished second year uni when I started noticing some pains in my leg. It showed up as a tumour. Not something you ever think about when you're 20.
I was a very avid soccer player and I just thought it was a knee pain. I was diagnosed with osteosarcoma September of last year. I've had chemo and 8 surgeries. Most recently I've had my leg amputated. So it's been a really long and hard journey.
A sarcoma is a rare cancer that affects the bones or soft tissue that can affect patients of any age. But when we look at the adolescent population, it accounts for 1 in 5 cancer patients of that age group. The mortality rate hasn't changed very much in the last 40 years.
With such a horrible survival rate, not many people tell their story.
Early diagnosis is key, and to think sarcoma is brushed off as maybe a sporting injury or a slight pain.
You're an athlete, you just hurt a muscle and it just keeps getting pulled or something like that.
Weeks of getting told it was normal pain.
With my leg, if I didn't operate, chances were I wasn't going to see Christmas this year. Having a young daughter, 3 years old, she's seeing more the inside of a hospital than she has a park. And that breaks my heart.
We'd like to see more funding, improve the care from diagnosis all the way through to treatment.
We know that patients have better outcomes when they're treated at specialist sarcoma centres.
We need to get better at how we do the genetic testing and how quickly it gets done so that the patients, once they're diagnosed, they know all the treatments out there. My story could be a completely different story. I might still have a leg. I might already be cured.
Unusual pains, unusual bumps, just get them checked.
You know your body better than anyone else, so if you really think something's wrong, don't just settle.
Even if you think you're being neurotic, it's important to follow it up.
Take that first step and see your healthcare professional.